Hello and welcome. Today we're diving into a specific eye condition associated with Marfan syndrome, Ectopia lentis. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. If you or someone you know has Marfan syndrome, understanding Ectopia lentis is crucial for maintaining optimal vision and overall health. Ectopia lentis, in the context of Marfan syndrome, isn't just a random occurrence. It's a direct consequence of a genetic mutation affecting fibrillin-1, a crucial protein that forms the scaffolding for elastic fibers throughout the body. Marfan syndrome is most often caused by a mutation in the FBN1 gene. The lack of proper fibrillin-1 synthesis weakens the suspensory ligaments, called zonules, that hold the eye's lens in place. Without adequate support, the lens can shift from its normal position, leading to ectopia lentis. Let's get a bit more technical. Normally, the zonules evenly distribute tension, keeping the lens centered behind the pupil. In Marfan syndrome, the weakened zonules stretch and break down over time. This uneven tension causes the lens to dislocate, most commonly upwards and outwards. This displacement alters the way light focuses on the retina, leading to visual problems such as blurred vision, double vision diplopia, or high myopia. The angle formed when the lens dislocates often worsens the impact of the condition. In some cases, the lens can even completely dislocate into the anterior chamber front of the eye, or the vitreous cavity, the gel-filled space behind the lens, which can lead to further complications. Marfan syndrome is relatively rare, affecting approximately 1 in 5,000 individuals. Since ectopia lentis is a major diagnostic criterion for Marfan syndrome, its prevalence mirrors that of the syndrome itself. This means that a significant proportion of individuals with Marfan syndrome will experience ectopia lentis at some point in their lives. It's important to note that while ectopia lentis is strongly associated with Marfan syndrome, it can also occur in other rare conditions, such as homocystinuria, making accurate diagnosis paramount. The signs and symptoms of ectopia lentis can vary depending on the degree of lens displacement. Many individuals initially experience blurred vision or a gradual change in refractive error. Double vision, especially monocular diplopia, double vision in one eye, is a common complaint. Some people may notice a shimmering or wobbling sensation in their vision, or see the edge of the lens through their pupil. Other symptoms can include glare, photophobia, sensitivity to light, and even sudden vision loss if the lens dislocates significantly and causes secondary glaucoma or retinal detachment. Diagnosing ectopia lentis in the context of Marfan syndrome requires a comprehensive eye examination. The ophthalmologist will dilate the pupils to allow a clear view of the lens and its surrounding structures. Slit lamp biomicroscopy is essential for directly visualizing the lens position and assessing the integrity of the zonules. Refraction testing helps determine the refractive error and assess the best possible corrected vision. Intraocular pressure measurements are crucial to rule out glaucoma. Genetic testing for the FBN1 mutation confirms the diagnosis of Marfan syndrome. Systemic evaluation is usually done by a cardiologist and geneticist to assess other manifestations of Marfan syndrome. Gonioscopy is used to evaluate the iridocorneal angle, which may be obstructed by the dislocated lens. While there aren't distinct classifications or types of ectopia lentis specifically within Marfan syndrome, the degree and direction of lens displacement can vary. It can be described as mild, moderate, or severe, depending on how far the lens is shifted. The direction of dislocations, e.g., superior, inferior, temporal, nasal, is also important to note, as it can influence the choice of treatment. The treatment and management of ectopia lentis aim to correct vision and prevent complications. Initially, glasses or contact lenses can be prescribed to correct the refractive error. However, if the lens displacement is significant, these may not provide adequate vision correction. In such cases, surgical intervention may be necessary. Lens extraction, either through lensectomy or phacoemulsification, removes the dislocated lens. An artificial lens, intraocular lens or IL, can then be implanted, either at the time of lens removal or at a later stage. Depending on the integrity of the zonules, the IO may be sutured to the iris or sclera for better stability. If IO cannot be placed within the capsular bag, the surgeon may consider an anterior chamber IO. Management also includes regular monitoring for complications such as glaucoma, retinal detachment, and cataracts. Currently, there's no way to prevent underlying genetic mutation that causes Marfan syndrome and, consequently, ectopia lentis. However, early diagnosis and careful management can help minimize the impact of the condition. Genetic counseling is crucial for families with a history of Marfan syndrome to understand the risks of inheritance and make informed decisions about family planning. The prognosis for individuals with ectopia lentis due to Marfan syndrome varies depending on the severity of the lens displacement and the presence of other complications. With appropriate treatment, Many individuals can achieve good visual function and maintain a reasonable quality of life. However, lifelong monitoring is essential to detect and manage potential complications. Research is ongoing to develop better surgical techniques and intraocular lens designs specifically tailored for individuals with Marfan syndrome. Gene therapy and targeted therapies are also being explored as potential future treatments to address the underlying genetic defect and prevent the progression of Marfan syndrome.